it is quite clear that we face the most serious and sustained crisis, something which is quite simply new to many of us and is something which our generation has never faced before. I believe that I would like to commend the speech by the former Health Secretary, where he pointed out the very effective action that's been taken in a number of Asian countries. And I would like to associate myself with the thrust of his remarks, that we need to take very clear and determined action as fast as possible, given the circumstances. And that means, obviously, much tighter social distancing measures and a much more active approach by the state. It also requires, as he pointed out and other speakers have said, the need for effective PPE and other supplies to our hospitals as soon as possible. And I should say that I have heard of cases in my own area, not my constituency but nearby, where there are real concerns about this. So we do need to look at what works, what has worked around the world in tackling this dreadful problem. There are examples where action has been taken immediately and it has constrained the spread of the virus. Now, I'm very pleased that the Prime Minister has now pivoted. He's listened to the World Health Organization advice and he's taken the UK on a different track. We do have a very narrow window of opportunity to stem the worst of this crisis. We've seen what's happened in Italy and in many other countries on TV news, and we do not want to see that in this country. And I would urge everyone to support the measures that are being taken forward. However, I'm conscious of time. I have some reservations about this bill, and I would like to echo the points made by our front bench, and in particular by other members around the House, the need for consent, for protection of the needs of vulnerable people, and for greater thought to be put in. And I would urge the government to take on board points made across the House today. The spirit of the debate has been extremely constructive, and I know the Minister is nodding and thinking about this matter. Please do take on board the points about both the wider need for social consent and for review mechanisms to be effective at minimum 6 months, possibly a further ability for Parliament to bring it back within a year as well if possible.